Oh my gosh, I have Speaker Moyle right in my sights. I'll be inspired the entire time. It's gonna be great. Yep, my kind eyes at the back of the room. I love that. No, not ever.
I'll nudge him if we didn't keep him in line.
Yes. Are you all ready?
John's got my back. I feel a lot better now.
Good. We're gonna get started, and then Avery, I'll ask that you shut the door if that's okay, just to keep some of the sound down. And hopefully I won't have a coughing fit in the midstream. But y'all, thank you so much for coming today. My name is Melissa Wintrow. I'm the Senate Democratic leader, and of course we have a great team that's here today to answer questions. We're going to provide a few just brief comments. I swear it's brief, and then we'll offer opportunity for questions if that's okay. I'm going to start us off today, and again, hopefully I won't cough. Although I think we're waiting for a camera, maybe, or not. Okay, thank you. The paparazzi, you know how that is. Okay. Right. Well, thanks, y'all. Thriving main streets throughout Idaho are the top priority for Idaho Democrats and always have been. We take the stewardship of our public dollars very seriously. Years of irresponsible revenue reductions have cut Idaho's revenues by over $2 billion. The people of Idaho for years have been asking us to end the grocery tax and reduce property taxes, but instead, year in, year out, my Republican political colleagues deliver top margin income tax cuts which overwhelmingly benefited the wealthy and well-connected. Millionaires received tens of thousands of dollars apiece, while regular working folks got about $48. And today in Idaho, a working mom pays more for diapers and food for her child than a corporation pays for the profits that it makes. That's an upside-down tax system in my estimation. As revenue is being cut, our vital infrastructure was left to deteriorate. Idaho accumulated $8 billion of needed repairs to bridges and roads, and over $1 billion in need of school repairs, as we heard today. In fact, a Pocatello school burned down due to faulty wiring, and all over the state, kids go to schools without heat, leaky roofs, collapsed ceilings, and today we heard about sewage under a cafeteria. Idaho is now 5% behind forecasted tax revenues, and we do not have enough revenue to meet these basic needs. And quite frankly, I'm excited to hear that the governor and others want a priority building facilities, but we should never have gotten to this point in the first place. We should have been responsibly paying those bills and providing for our kids all along. We're very frustrated that schools were put in the back of the line, only to be considered when the pockets of the wealthy were fully lined. But we're glad the governor's finally looking to address this, but unfortunately we did not hear any plan to address the $162 million cut in education funding that occurred as a result of switching from the enrollment-based funding model. Democrats are fierce supporters of public education, and we will do everything in our power to support funding the school for our personnel and our facilities. And the first step is to fight the renewed voucher scheme that we saw hatched on Friday, and we know those efforts are coming. Vouchers or ESAs, whatever you want to call them, tax credits, will siphon money away from public schools and present a threat to a successful, adequately funded public education system in Idaho. And we've seen those disasters in other states, and we heard tell of them today, Arizona and Indiana, where their budgets have ballooned out of control, all the while draining funds from vital public schools. We're also committed to launch, and that we're committed that remains fully funded. It's proven to be a popular, very popular program and has received over 12,000 applications. It offers an unprecedented path to opportunity for Idaho's youth, but unfortunately it was opposed by a majority of my Republican colleagues last session, only to be passed by Democrats. So I hope that looking at the data that has been provided, that'll be a persuasive enough that we'll all be on board to collaborate for its future. Beyond education, our priorities include health care, addressing the crisis in Idaho that's facing the direct care workforce. We've heard over and over people suffering and folks that can't find basic services in their homes to stay there. We'll work toward restoring the Maternal Mortality Review Committee that was disbanded by my Republican colleagues last session, and also to advocate for increased Medicaid coverage for moms postpartum. We, of course, would like to see the decriminalization of doctors that we have seen create an exodus of medical professionals from our state. But I'm not necessarily optimistic that we're going to find a meaningful solution to the disastrous total abortion ban given the current makeup of the legislature, and that any meaningful consideration will be given to women's health this session. We strongly support the proposed investments in infrastructure and public safety, and we hope that we can have bipartisan collaboration toward a civil and very productive session.
Thanks. I'm Representative Alana Rubel, the House Democratic leader. Thank you all for coming today. I'm going to have short remarks so we can leave room for questions for you all. We Democrats have a philosophy of government that will guide us through this session as it has guided us in the past. We believe that government is at its best when it addresses the real needs of our citizens and when it efficiently delivers high-quality necessary services to the community. Services like public schools, roads, bridges, parks, police, and fire protection. We believe, on the other hand, that government is at its worst when it places the interests of moneyed, out-of-state lobbyists over the actual needs of the people we represent. We believe government is at its worst when it meddles in people's private lives, telling people what health care they can get for themselves and their children, what ideas they can discuss in classrooms, what books they can read, even what clothes they can wear, as we have seen in recent sessions. We believe government is at its worst when it's used for self-entrenchment through manipulating voting laws to suppress the votes of those who might oppose these politicians' agendas. Sadly, in recent years, too many of our Republican colleagues have adopted the opposite guiding of philosophy, carrying a social agenda brought by out-of-state ideologues that is focused on attacking libraries, attacking medical freedom, attacking free speech, attacking voting rights, while neglecting our most basic needs: public education, infrastructure, affordable housing, and health care. We know that this year will likely be a replay of recent years in many of these regards. There will be lots of culture war distractions and attacks on vulnerable minority communities, attacks on libraries, attacks on voting rights, etc. We Democrats will continue to stand up to those attacks, and we will work to protect all our freedoms, from reproductive rights to voting rights to freedom of expression. And we will fight hard for the things we know Idahoans actually want and will benefit from: well-funded schools, workforce training, affordable housing, property tax relief, safe roads and bridges, public safety generally, and healthcare access. And with that, I want to answer any questions you might have. Bueller? Yeah.
Does the Democratic caucus have a position on the proposal for mandatory minimums for fentanyl? There was a bill last year that didn't make it across the finish line. Does the group have a stance?
Well, I don't know that we formalized the stance. I can certainly tell you my stance and what has consistently been where most of our members, if not all, have shaken out. We recognize that fentanyl presents a very grave threat to public safety and needs to be taken very seriously. We do not believe that adding it to Idaho's current deeply flawed mandatory minimum statute, however, is the answer. I have heard from many people in the judiciary, practitioners, you name it, who have identified Idaho's current mandatory minimum laws as the greatest source of injustice in Idaho's code. It is a disaster. It does not measure whether you're a dealer. It doesn't measure the actual amount of drugs. There's no exception for first-time nonviolent offenders. It is this bludgeon that in many cases actually forces innocent people to have to plead guilty because the system is so rigged. Expanding that system is not the answer. And actually there's lots of data showing that there are many other better ways. More police on the streets would, better education. There are many far better ways to address our fentanyl problem than simply locking up first-time nonviolent offenders who are largely often users, not dealers, and then sometimes may not have done it at all. So unless there can be reforms to our current very flawed system, I think aggravating the problem is not the answer, and adding more drugs to this disastrous statute is a bad idea. Yeah.
Superintendent Critchfield has asked for $40 million tied to student outcomes. I was wondering if you had any thoughts on that strategy.
Janie,
Do you want to answer that,
tackle
Janie?
Well, I'm happy to, and I think there's, there's a
We have to
good.
step up to the microphone.
Sorry.
Switch.
Excuse me.
I'm happy to weigh in on that. I know that the superintendent has a plan, and it's kind of a pilot program to see that if we can use some of this money and find some really good best practice situations, and if we can improve outcome, then that's a good use of that money. I think in reality, there's probably some other things that need to come first that need to be funded in education. And those are, of course, continuing to fund the literacy program. We know that's working. We've seen good results. We've seen jumps in our reading scores, so we know we're doing a good job there. And I also think that we need to address the facilities issue. It's huge. And though we did a little bit of property tax relief and some money for schools last year with House Bill 292, it really didn't address the need to build new schools. And we are a fast-growing state, and so those are things I think that might come before that. But I think it's a reasonable request on the superintendent's part to say, let's go ahead and see if we can move the outcome needle a little bit.
And just adding to what Senator Ward Engelking just said, I know that 292, it was helpful for property tax reduction, but it was not a school facilities bill. Of the $108 million that I think was earmarked out of that for school facilities, I think statewide only $8 million actually made it into school facilities, 0 of which made it to any Boise schools. So it really did not succeed in flowing any meaningful dollars toward fixing the sewage in the cafeteria or the collapsing ceilings or the collapsing roofs. We all wanted lower property taxes, that's great, but it was not a school facility solution. Clark.
We've heard from the Republican co-chairs of JFAC about some of the changes JFAC is making this year. I don't think I've had a chance to talk with your party about it. I know there were changes to JFAC last year and more will continue this year. I wanted to ask Representative Rubel and also Senator Ward Engelking, who serves on JFAC, to both take a minute and discuss what they've heard about and what they expect the changes to be and how that might affect the budget process or the transparency in the budget setting process. Senator.
Thank you, Clark. And I have a couple of concerns about the new process. One of them is we've always been, as JFAC members, been able to work any budget we want. And now we're being assigned budgets. Now, technically, we can work the other budgets, but we won't be part of the workforce or the little group that meets together because we're assigned to a budget group that works at the same time. So that minimalizes our ability to work on other budgets and that weren't assigned to us. I'm also very concerned about the transparency. We're cutting the amount of time for presentations in JFAC by about half. And so I'm worried the public isn't going to have the same information. It's not going to be as transparent. Those questions that we now have to ask the directors on our own time or by meeting with them personally will not be in the public record. And so that's a concern for me. Those are two issues that I worry about.
Just briefly to underscore that, I don't serve on JFAC myself, but I certainly share the concerns that were just expressed by Senator Ward Engelking. JFAC is a desperately important committee. The most important thing we do here to keep the lights on in the state is to issue those budgets and to pass those budgets and to reduce the amount of time for consideration and to reduce the amount of information that is visible to the public is of some concern.
Can I add?
Yes, please, Senator.
Yeah, the only thing I would add to that too, I really appreciate all those comments. I used to serve on JFAC, and as Senator Ward Engelking said, being able to work multiple budgets is really important. And the time that you have in committee to ask the directors and others questions that need to be on the record about their budget is really important. And as we've heard, that would cut transparency. The other thing I'm concerned about is the discussion about passing maintenance budgets, capping spending, and actually what I think is artificially manufacturing a surplus to do pet projects by some legislators. And that would be a concern, that if we don't pay the bills and fund the vital things that we need in our state, like roads, schools, health, et cetera, that we're gonna cut those vital services to manufacture that surplus so that we can do our own pet project, which I think causes me some pause.
Thanks to each of you.
Yeah, Kevin.
Yeah, I asked you all kind of the same question I asked the speaker a few minutes ago. Is there room budgetarily or politically this year to do both the facilities program the governor outlined today and some sort of pilot on school choice?
I think all of us would raise the
I don't think so. I don't think so at all. No, I mean, the facilities money that the governor's putting forth is bare bones. It's a fraction. Now, what he's talking about is $1 billion over 10 years. We need $1 billion today for school facilities, and that's just to repair the ones we've got. That's not to build new schools for all the influx of new people coming here. That's not accounting for the things that are going to break next year and the year after, the year after. By 10 years from now, we're probably going to need $6 billion to fix our schools. So the money that is in there is not adequate, but it's critically necessary. It can't be cut down. At least the numbers I saw from the governor's budget, again, we have hemorrhaged revenue over the last few years. We have chopped and chopped and chopped so that we are now pretty darn lean. There is not much money to spare. And so, school choice, I guess I'm going to push back a little on that term because I think we already do have school choice. We already do have charter schools and online schools and home schools. We have all kinds of options for people already. But, I guess we don't currently have the public dollars being siphoned into private schools. That, as we learned today, has been a giant money pit. That's going to eat the whole budget. That's not just going to eat the facilities part. We opened that. We saw it's up to $1 billion in Arizona now when it was promised to be $60 million. When people open that door, it becomes, the budget item that ate New York. And so I don't know that it will not only eat up any possibility of facilities fundings, it will wipe out 10 other programs if we open the door to those voucher schemes. So no, I don't think there's any room under this year's budget or under any future budget to open that door, nor do I think is in any way a good idea in terms of being good, responsible stewards of taxpayer dollars. But others?
I think that's a mic drop, but go ahead.
No, I think that was a Godzilla reference, in case you missed it.
No, but I mean, frankly, I have just been astonished that this has been presented as a conservative policy solution. I find this baffling. I don't know on what planet giving away free taxpayer dollars with no accountability whatsoever is considered conservative. I thought the conservative thing to do was to require accountability and be very careful with the spending of taxpayer dollars. But I think there are just so many really dangerous things from this proposal, among which is that it will incentivize people to simply not send their children to school at all, which in a state that's already struggled with incomes and go-on rates is really a head-scratcher. Why on earth would we tell a family with 4 kids, hey, just don't send your kids to school at all and you'll get $20,000? Perplexing indeed. And again, I just don't understand how giving away free taxpayer dollars to people who don't have any assurance they're actually going to educate anybody, that any of them will emerge literate or knowing anything. How on earth is that conservative? It seems like the most anti-conservative thing on earth. So I think I've only given 10 reasons. We have at least 50 reasons to oppose vouchers, but we'll leave it at that.
And Janie has 60.
Kevin, it would be nice to see as much emphasis on where those dollars would potentially flow as how much emphasis will be placed on health and welfare this year. I'll just say that.
Yeah.
Hi, Kyle with the Idaho Capital Sun. Today, the governor, not in his State of the State address, but in his budget highlights, talked about a policy for people on Medicaid expansion to have work requirements placed. This isn't Idaho's first attempt at work requirements. The governor's budget, the budget chief called this a philosophical proposal, not one that's looking to save costs. Does the Democratic Party have any stance on work requirements for Medicaid?
Well, yeah, I mean, we already passed them a few years ago, and they were rejected by CMS at the federal level. So that bill's already been passed. We voted and debated against it then. I imagine if they want to repass the same bill, I imagine it would have much the same outcome. But it was rejected by the feds. It was not cost effective. It would require erecting quite a substantial government infrastructure to police. It would require staffing up the Department of Health and Welfare substantially to chase people down and run all these work training projects. In the end, I don't think it would save us any money. And frankly, I don't believe the people, you have to be really poor to be on Medicaid expansion. You have to be, the federal poverty level is darn low. It's like $12,000. I know it's more than that. I think it's $14,000 a year? So basically you have to be living on about $16,000 a year to qualify for Medicaid expansion. There are not a lot of people who are living at that level of poverty voluntarily. These people a large number of them have significant mental health challenges. There's a lot going on in their lives that is preventing them from working. And just passing a law saying, you person who's largely unemployable, having severe mental health problems and all these issues, we're gonna make you go work or take your Medicaid away, does not make a lot of sense, especially when it just adds a tremendous administrative cost burden to the state. state. But as I said, I think we already did it back in 2019, and it was rejected by the feds. So regardless of what we think, I think the federal government's already spoken on that.
Can I add?
Even the Trump administration rejected that one.
Yes, and I would say too, Medicaid expansion, we know that Idahoans value access to quality health care, and that Medicaid expansion has produced an efficient, effective way to get that health care out. A third of the folks on the expansion population have serious mental illness, a third. And so if we care about behavioral health in our state, which I know we do, we would not cut that program. Half of the Medicaid folks are kids. And when we look at the direct care workforce shortage, when we look at the expansion population, 20% of that expansion population is our direct care workforce. So people that are working 1 and 2 jobs to do the work to keep people safe, you have disabilities, et cetera, they're on Medicaid. That's how low the incomes are. So we need to make sure that we safeguard the access to quality health care for all of our working families in Idaho.
Honestly, philosophically, I know there's been concern about the number of people on Medicaid and the cost of Medicaid, which is actually flat, by the way. The state portion of Medicaid is level, and it's basically completely flat. I know it might have gone up $100,000 or something statistically insignificant. But if we are concerned about this, and I'm concerned, I think we'd all like to have fewer people on Medicaid. But the answer to that is to address the root cause of poverty. It's not to kick starving people off of their health care. It's to do things like launch, to train them for better jobs. You train these people to be a welder and make $80,000 a year, you just got them off Medicaid without leaving them dying in a gutter. I think there are much better ways to address it and to get people off of Medicaid, and it is by boosting prosperity and boosting earning power.
Ooh, that was a good
Question for Senator Mitchell. How do you feel about how the transition in the public defense system is going so far?
Ooh, good question. Wow, things are still new. It is transitioning. I think there are some question marks on who's providing child protection cases and so forth. So I think that does need a little bit of scrutiny about how that transitions, but it's pretty young, it's pretty new. I think all of us will be watching that and really trying to do our best to support that, because that is a good step forward in our state. We were being sued for not providing appropriate defense for indigent folks, and I think across the country people have been looking at Idaho as that is a good first step, but we need to make sure we keep the funding going and the appropriate supports and structures there, and then also work with our counties to see where are there some possible holes that we need to address. Yeah.
Anybody else? No one wants to talk about abortion? All right. No, guys, oh, yeah. Had to chum the waters a little there, okay.
Sorry, I'm going to ask a non-abortion question. For Representative Burns and for Senator Ruckte, you two are Democrats who are not from the Boise metro area. When we listen to Representative Rubel and Senator Wintro speak, oftentimes they say that your party represents more of the majority of what Idahoans think. Why are you successful in getting elected in your districts when so much of Idaho is so strongly Republican?
Well, I can't speak for Representative Burns' district, but Pocatello is just filled with people who are pretty reasonable, and they expect government to run efficiently. They don't like to see a lot of fighting over here. In fact, it's a real turnoff to them when Republicans and Democrats emphasize their party affiliation over just getting things done. They want bills paid. If you've been to Pocatello, you know it's kind of a blue-collar community that has a healthy mix of a institution of higher learning, and they just don't care for nonsense. So the reason I get elected again and again is because when I come over here, I focus on the issues that are really important. That's healthcare, that's public education, and preserving public education. It's making sure that we are setting budgets that are set based on some of our leanest years, not budgets that are set on huge budget surpluses, which is what I fear we're doing right now. We've gotten so used to having budget surpluses that we're coming up with all these neat ideas and we want to fund them. We can't do that. We got to do the basics, and the basics are public education, higher education, transportation, roads and bridges. Do those things, And people outside Boise and in Boise are going to be really happy with what the legislature's doing. So that's what I focus on.
I would echo similar statements. You know, I come from local government, had probably one of the leanest budgets in the state that I had to work with every year, focused on getting things done that the people of Bellevue needed. I've come to Boise to focus on the things that the people of District 26 need. Similar, you know, public education, health and welfare, transportation, making sure that we protect our water, and continue to grow as a state. And I think the people of District 26 understand that, you know, I'm not here for shenanigans. I'm here to get things done.
Hey, Liam Berger Casey with IDLCC. With the recent EMTALA decision, do you think it's safer, or do you think it's safe for women to live in Idaho now? I know that many of you would say it wasn't before, but given that, what have abortion restrictions done to the state's overall safety for women especially?
Well, I think it's a disaster, and this the latest decision, I think, first of all, let me back up and say, for the life of me, I do not understand why our leaders and our Attorney General decided they needed to spend $500,000 to overturn the original injunction. The original injunction was incredibly limited. Judge Windmill's ruling just said, in serious medical emergencies requiring an abortion to stabilize the patient, that is the only exception to our abortion law. For some reason that is far beyond me, our GOP leaders said absolutely unacceptable, no matter how bad the medical emergency is, absolutely no way can they have an abortion. Judge Windmill threw us a lifeline and saved us from a bill that was frankly crazy. It was passed at a time when Roe v. Wade was still on the books. Most people never thought it would go into effect. Nobody saw Roe v. Wade being overturned. Then they were the dog that caught the car. Roe v. Wade was overturned, and all of a sudden, this kooky draconian law actually became reality. Judge Windmill actually threw us a lifeline and said, actually, when a woman's hemorrhaging and in danger of, you know, permanent infertility or loss of a limb or loss of a body organ, you can give her an abortion. For some reason, they fought like hell to get that turned down, and now there is no exception. And no matter what is happening to you, basically, unless you can prove 100% you're going to die, that is the only exception. What happened in Texas recently with the woman with the fetus that was going to die, and she was facing dire health emergencies, and she had to flee the state, that is exactly what would happen in Idaho. And it's not just doctors leaving the state, it's women and families and people who want to have families. I hear it all the time. A friend of mine in my book club just said she just lost her pastor because they wanted to have kids and they didn't think they could do it safely in Idaho. This has become a fundamentally unsafe place because if, God forbid, you have a complication, you are up the creek, and you better hope that your complication isn't so urgent and severe that you don't have 12 hours to hightail it out to Oregon. If you need help now, you are in trouble.
I don't know what more to add to that other than the human side of this. You know, we debate women's health, which I think is pretty unacceptable. The human side of this is that people are suffering. I don't know how many of you saw on Friday the Nightline On the Brink special where they interviewed 18 women in the United States who have basically suffered in crisis pregnancies and denied access to care and had to travel, and some of the things that happened to them. One woman was from Idaho. I suggest you watch that, but it was heart-wrenching. And I think sometimes we forget behind all these numbers and ideologies that there are real human beings suffering, and that women are more than put on this world to be means of production. That we need to do better. And we need to not just put things in print and say it exists. There is no rape exception currently. It's in the books, but you tell me what policing agency has created process and procedures in this state to provide a permission slip for somebody to go to a physician and get an abortion. And by the way, what physician in this state would put their name publicly on a list to give an abortion when they know they could be sued privately by our bounty hunter law? And by the way, you have to be within 12 weeks, and how many women even know they're pregnant within 12 weeks? I could keep going. But I have talked to people in this state who have been raped and are not getting the standard of care they need, and they are traveling out of this state. It is unacceptable.
I've heard a lot of lip service from the government and others about how Idaho, they want it to be this great welcoming state that everybody wants to come to. But unfortunately, these extreme laws have made this a state that people need to flee.
When your Republican colleagues talk about abortion, their focus, of course, is the stance is that the fetus in the situation is a life with equal weight to the mothers. Is there any daylight in your caucus's eyes between what they would call an elective abortion versus an abortion for healthcare reasons? Is there some sort of middle ground that your party would come to with the Republicans, or what? Basically, you're not going to get your way. So what do you do about it?
Well, anything's better than what we have now, but it's not good enough. I mean, I believe that, I guess I may be different. I don't want to project my views onto others. My view is that the debate isn't necessarily about when does life begin, to the beginning of conception. My view is more, when can the government force somebody into an involuntary organ donation? Because that's what you're talking about. Sure, if the fetus is maybe they're a person who requires a 24/7 organ donation from another person in order to stay alive. You find me one other case in the law where a person is required to give a 24/7 organ donation to another person for 9 months. That is not something we would ever do to a man. But somehow it's considered acceptable for the government to force that upon a woman. That said, I think that, clearly at least, allowing women to have, abortions in the case of health emergencies would be some improvement over what we have now. Right now, we are rock bottom. We are the worst in America. Any incremental improvement would make it more likely that women won't die and that people won't flee the state. So, yeah, it would be better. But I don't think it's not good enough in my eyes until women are treated with the same degree of freedom and autonomy as men are.
And I guess I would just add, this is an issue that's we know has been heated over a long time, and it's complex, and people have their own personal beliefs and their religious beliefs about it. I respect that. What I don't respect is when the government interferes in my private life and then creates a situation that my own health might be in jeopardy, and that we have to deal with women who are suffering and on the brink of dying. My issue is with the government forcing the pregnancy and the government interfering in that personal private decision. That should be made with her family, her physicians, and her own hire maker.
And it was rich in irony to see during the COVID era how outraged everybody was at the suggestion that the government could ever possibly force you to have a shot in your arm that you didn't want. And I'm not supporting government-forced vaccines in any way, shape, or form, but that was considered the greatest intrusion on autonomy that could ever be imagined. But somehow the government taking over your entire body for 9 months and forcing you into involuntary pregnancy and childbirth is somehow a mainstream, reasonable position. I don't all the my body, my choice signs in the balcony I thought were really a little bit at odds with what Idaho's complete abortion ban dictates.
Thank you.
Thank you.
You guys are amazing. Appreciate you. Keep up the great work, and hope things will go good for you. Thanks for your hard work.